So what we like to do before you do any maneuver, any exercise, activity, or NMR, we want to have our patients set the core or activate their abdominal brace. Our abs are one component, then we have our obliques and our lumbar paraspinals. So what we're going to do is teach the patient to turn on those muscles so they can function as their natural back brace. So we're going to take our 2 fingers, we're going to find our ASISs, and we're going to roll 1 inch forward, right? So they can feel that muscle. When they're going to contract their abdomen, and you should feel them push against that. So regardless of patient's body size or shape, they should be able to feel that muscle activate. We do not want a hollow or a suck in. That's not going to put our muscles in a strong position. We want to brace and bear down. Make sure your patient, everyone likes to look down. Make sure your patient's going to be looking straight ahead, breathing, not holding their breath, not squishing up their scalenes or scrunching their eyes. We want them nice and neutral. Once they have this, you can drop the hands, because I've noticed that when we hold the arms like this, they're going to start hollowing them forward. So they can drop their arms. And then we want to make sure that they can hold that brace with respiration. Once we feel like our patient can do that, you can add a side movement. So we can either just have them walk and do that, or we can have them raise a high knee. You can check to make sure your patient is doing that by having a nice wide-based hand and asking them to resist their grip. So you have kind of get a nice hand, you say resist my grip, the patient should push out to meet it, right? So it's an activation of that muscle. And then you can use that as a check, okay, resist. And as they're doing their other activities, you can go through, okay, let's make sure, is your abdomen tight? Have you activated the core? So that's one part of it. Once they can do all of that with respiration, then we want to address the pelvic floor. The pelvic floor is an often forgotten component of our abdominal core that is going to attach onto the core from below. So what we can do is act like we are trying to stop the flow of urination and defecation. Let's make sure we use the proper medical terms when we're talking about this, because we want to make sure the patients know that we're being very professional. So you have them squeeze like they're trying to hold in a bowel movement, and then that is raising from above. And once they can do that, make sure they're breathing, then you can layer on the front part to activate the core. So it's kind of like lifting from the bottom up and from out in. That's going to stabilize that. Now our core is tight. If they're having pain, they're contracting it too hard. This should all be pain-free. So this is just turning on our natural back brace. This will help our patients when they perform any ADL, getting their children from the bed, getting groceries, making dinner, cooking, cleaning, especially sweeping, mopping. These are common areas where people have pain, so we can activate the core and then perform our activities, and we're going to be safe when we do that.